So I'm Dr. Scott for Select Spine and Sport, and we're just going to talk a little bit about what adhesion is. Adhesion comes from the result of you overusing your body. It can happen anywhere in the body, and the more you use something, the more you're going to overuse it. It doesn't matter if you have the best form possible. If you do too much, you are going to end up developing some adhesion. Now, all of us have adhesion all over the place. We develop different amounts for different activities, and the more well-trained something is, the less likely you are to develop it. But ultimately, it comes down to this. It's everywhere, but if it's affecting you and causing problems, which is quite possible, that's when it needs to be addressed. So we're going to go over one simple range of motion test, and these can be, there's tests for any part of the body to see if you have adhesion. But we're going to go over a very simple knee one today and just talk about that and how it's affecting the knee and how it can cause pain. All right, so we're going to go over a very quick test with the knee. A healthy knee should have nice full range of motion, and the number one limiter of range of motion is going to be adhesion. Could there be other things? Certainly. You could have joint degeneration, you could have arthritis, those or a previous surgery. Any of those can limit range that isn't adhesion. But depending on your history, a healthy knee, you should be able to bring your heel all the way to your butt. So I should very simply be able to gently push here and bring that heel all the way to his butt. As you can see here, we have some limitation. Now that limitation is likely due to adhesion. So Nick, I want you to just grab your shin, not your ankle, and I want you to pull it to your butt. This is a test that can be done at home. If you cannot easily bring your heel to your butt and there being no tension in the knee or the quad, then you have a problem. You can relax. So adhesion is going to act like a glue, all right? It's going to stick onto, in this case, the joint capsule or the patellar tendon. And when it's needed to stretch out, it won't do that. So you'll have tension in the knee because the rest of the parts of those structures that are ineffective have to stretch even further. So now we have this really intense stretch. And sometimes we might even get a pinch in the back of the knee. And that means if my hands perhaps, let's say, are your knee, instead of maintaining a healthy amount of joint space here, if those structures on the front side don't stretch out, now we end up pinching the back and we end up actually crushing the meniscus. If this persists, that's a really good way to tear a meniscus. So this is just one simple way for you to determine how to see how healthy your knee is. Think of this as taking blood pressure for your knee. At our office, we also do a number of other tests, whether it is elbow, wrist pain, back pain, ankles, necks, shoulders. They all have their own test, and they can all be objectively scored to see exactly how much function you have. When combined with a thorough history, we can get a very good idea of exactly what to expect with treatment, or if we should be even treating at all. If you are riddled with adhesion, but you also have several prior surgeries, and you're of an advanced age, my expectations are going to be lower. But if you're younger, let's say you're in your late 20s, early 30s, you've been active and you have these problems and you have no prior history of surgery, it's very likely we'll be able to get you back to functioning 100% and feeling great. Well, thanks for watching. If you think you have adhesion, and it could be somewhere else in your body, there's some really good indicators that say, I have adhesion. One, you have nerve, muscle, or joint dysfunction. So adhesion can entrap a nerve. It can compress joints. If you have tingling, if you have this intense stretch or a pinch, those are all good indications. Or if you've had this problem for more than 6 months and you've seen multiple healthcare providers, or even massage therapists, chiropractors, physical therapists, orthopedic specialists, any of these, and not have seen the results, you and I should have a talk. So you should come in for our assessment. We'll do our range of motion assessment. We'll talk a nice history, get to know each other, and see if you'd be a good fit for our care. Thanks.